Physiotherapy in the, probably I would say 10 years ago was basically a university degree, so you could actually enroll right in from high school, so you graduate with a bachelor. But I would say since about 2005 within Canada, it's actually become a master's degree. So you have to have a degree first and then go through the application process and you will get in. And they compacted the program into about 2.5 years of program, which includes a lot of in-class learning, but also in addition to that there's a lot of practical components, and then there's 1,000 hours of supervised practice before you're able to graduate. And after that you will go through a national licensing exam to obtain your certificate or your diploma to be able to practice. And then within each province has its own college to regulate the physiotherapists within that province. So that's kind of, we would call the entry-level education for physiotherapy. And there are a lot more courses in the 3 divisions that we talked about. And since I'm in orthopedics, so within our orthopedic division, within the Canadian Physiotherapy Association, there's a lot of training courses. So particularly, I went through the manual and manipulative therapy diploma, which was about 5 levels of courses, and you have to go through a number of exams to be able to obtain that, which is quite an extensive process. So currently, there's probably only about 5 to 10% physiotherapists in Canada actually has that diploma. We're hoping that we could encourage more students to go through this process and have more advanced learning to achieve we call the advanced diploma in manual and manipulative therapy. Now, what that therapy diploma gives you are definitely a lot more in-depth knowledge about various condition pathology, but also your skills will improve. And for example, I do perform spinal manipulation, which is one of the protective acts within physiotherapy as well. And that's very, very useful in certain conditions when a joint is fixated. We really do need that technique to free it up. So I would say that's within the physiotherapy field with the extended and continual education. There are other courses such they call NDT, which are more for neurological physiotherapists. And apart from there, these days a lot of physiotherapists will undergo training through acupuncture. And through acupuncture, we could actually utilize acupuncture's effects to really help with pain, help with inflammation, and bring down inflammation. And I would say for neurological conditions with nerve pains, acupuncture is actually quite superior.